You've made it to Chiro Hustle. Sit back and learn from the greatest influencers in the profession on the world's #1 chiropractic podcast. This episode is brought to you by Peach State Payments, ethical processing, more profit, less stress. Chiro HD, more than an EHR, practice management simplified. The Chiro Speaking Company, attract, educate, and convert. Chiro Spring, cloud-based, user-friendly software with all the essential features chiropractors need. OmniWave, redefining comfort and acoustic wave technology. The ChiroHustle Podcast is sponsored by Chiro Health USA, ChiroScript AI, Chiro Moguls, Pure Chiro Notes, 5-Star Forge, Titronics, Sherman College of Chiropractic, Life Chiropractic College West, and the IFCO. Let's hustle.
Hey guys, welcome to episode 749 of the ChiroHustle Podcast. I'm your producer, Luke Millette, and here's your host, James Chester.
So today we had an opportunity of interviewing Dr. Deb Cirone, and if you want to hear her story about 27 years in practice and coming from a chiropractic family, stay tuned for the full episode.
Welcome back. This is another episode of the ChiroHustle Podcast. Today I have Deb Cirone coming on with me. I'm really excited. 27 years in practice, lots of great stories that we're going to touch on today, from early stages of DE to now teaching chiropractors how to have business acumen in the real world. So we're going to talk about some of those topics today. But before we jump in this episode, I want to let you know the big why. Why do we do what we do over here at Chiro Hustle? Well, first things first is protecting freedom of speech. We've never censored anybody. Everybody that's ever given their word on our show, we've aired it. So that's something really special because we know what it's like to be traffic throttled and shadow banned and censored. We'd never do that to you. We also believe in medical freedom and family health freedom. Some people think that they're the same things, but they're not. If you're confused about those topics, reach out to a chiropractor in your city or state, and they're going to help you out with those topics specifically. We also believe in protecting the sacred trust. It's B.J. Palmer's last written words. If you don't know what that is, go to the show notes, check it out. And even if you've been practicing for 30 years, you're going to fall back in love with this profession once you know what protecting the sacred trust means. Philosophically speaking, I know we shouldn't have to talk so philosophical at the beginning of the show, but something I'm really passionate about is they're taking the language out of most colleges. So we have to front load this show with talking about subluxation, innate intelligence, universal intelligence, and educated intelligence. We believe that when man or woman, the physical, gets adjusted, it connects them to man or woman, the spiritual, which creates educated intelligence. And when you understand the philosophy of this chiropractic profession, nothing else is like it. And that's why we support this beautiful profession of chiropractic. And Deb, you are episode 749. Welcome to the show.
Thank you. Thanks for having me.
Yeah, it's so much fun. And I got a chance to get to know you on a deeper level. 20 minutes of chatting before this, we hit the go live button. But, you know, you have such a really cool story from, you know, you sent over like this, all the answers that you had for the questions I have for you. But when I was reading through them, like, you have this family history within chiropractic that got you inspired and pulled you off your other pathway to become a chiropractor. So let's share that story about how you got into the profession of chiropractic.
Sure, I'd love to. So my uncle was the first chiropractor in my family, graduated from Columbia in New York back before it was NYCC. And he thankfully convinced my parents no vaccines, adjusted the day she was born. And I've been adjusted for 55 years, at least weekly since. Even in college, I would drive back home and get adjusted. And, you know, my dad always tried to convince me that I need to be a chiropractor. And my uncle was known by everybody in town. Dennis Cirone, everyone knew Dennis Cirone's name. He was all over the place. And he was, you know, part of the New Jersey organization when some of the big DE docs were running it. And so my dad kept saying, chiropractor, chiropractor, chiropractor. And of course, because it was my dad, I was like, no chiropractor. So then I was in school for athletic training. And my brother was in chiropractic school. I want to say he was probably number 10, 11, maybe at the time. And he, after talking with him every single week, he literally called me telling me all the reasons why I couldn't say no. And finally I didn't. And I decided to go to school, got back together with my now husband, who we were broken up for a little while. We've been together since high school. And I was like, hey, I'm moving to Georgia. He was like, well, then we have to break up. I was like, what do you mean we have to break up? He's like, I can't do long distance. I said, you love chiropractic. You've been adjusted by my uncle since you were 12. So why don't you become a chiropractor? And make a really long story short, he said yes. So we suckered him in. And over the years, we suckered a lot of other people in. Actually, my uncle got the very first ever Life University Sphere of Influence Award because he sent so many people to school. I want to say like 7-8 years ago when he got the award, it was well over 100 people. And even when I was in school, there were 17 people in my school, in Life University, at the same time from my town, from my uncle. That's pretty incredible.
Well, that's the power of influence, and
sure.
when you're onto something and you have such a passion for it, that it's life changing. Like that's the real power of chiropractic. When I grew up in Davenport, Iowa. So,
Awesome.
the other big city where chiropractic thrives, outside of Marietta. But when I got into it, I didn't know anything about the profession. I just knew that when I got adjusted, I felt better.
Mm.
And as I got older, my first adjustment was 16. But as I started to get older, at 30 years old, I was like, I need to dedicate my life to something. And just like with you, I mean, chiropractic just made a lot of sense to me.
Yeah.
And I got my background in marketing and journalism, but I was like, I can still use those skills within the chiropractic profession to amplify the message of chiropractic and to, bring guests on to, I didn't even know what a podcast was.
Yeah.
But I'm like, we're going to do a podcast and we're going to start telling the story about chiropractic because one day, I think Joe Borio, is he a New Jersey guy?
Yeah.
So Joe Borio was speaking at Mile High, the first one. And he's like, you just have to go tell the story. And he must have said that line like a half a dozen to a dozen times while he was on stage.
Like,
and I'm like, Joe, after he got off, I was like, I'm not a chiropractor, but I'm going to go tell the story.
oh, awesome.
Because he inspired me so much. So just like your uncle, inspiring all those chiropractors to go to chiropractic school from your town, like one person that says the right thing to the right people can change their trajectory of life too.
Oh, there's no doubt. And I have to say, I would say probably even though my cousins, his daughters didn't become chiropractors, one of them married a chiropractor, but they didn't. One's an acupuncturist, but my aunt and all of my cousins have probably referred at least as many people to chiropractic school as my uncle, because when you're on fire, people come to watch you burn, and we were all immersed in it all the time. So it just became our language. I mean, not as much for me as my cousins in the house all the time, but, we were always, if we got adjusted no matter what. I mean, this is how dedicated my family was. My uncle had a very large practice. Actually, the first 8 years, it was a box on the wall. People would literally bring him live chickens and lasagnas and whatever. But anyway, as time went on, his practice just kept getting bigger and bigger. We would go to his practice, sign up on this paper sign-up sheet, wait in the waiting room for like 45 minutes or an hour, or go to the store and come back and figure it was about our time to walk in. We would park all the way around the next neighborhood to get to the house that he built his practice in. And we would act just like everybody else. We got no special treatment, except of course we got adjusted at his house, or he would come to our house. But we did all the same things that every other person would do. I would drive home from college to get adjusted. Like, we really understood the value of chiropractic. And I think that's one of my fears of young chiropractors coming up, is they don't understand the value enough to speak it regardless of what darts are going to come at them.
Yeah, I mean, it's a lifestyle, as some people say. Chiropractic is a lifestyle, but chiropractic is also, it keeps people connected with themselves. Like when I say it connects man or woman, the spiritual to the physical, and creates the educated, that's not just like me waxing eloquence of language. Like that is for real. Yeah. Like when you're connected and your body's able to be, as chiropractors say, above, down, inside out. Like when the body's connected from above, down, inside out, it needs nothing extra in it. and it just needs no interference. That's as old as you can get with philosophy. And you understood that. And that's why, you'd come home from college to get adjusted, or you'd make it a priority. I was talking to one of my friends today, he's a chiropractor, and I said, if you make anything in your life priority, it gets done.
It's true.
And he was talking to me about how patients sometimes don't commit to care and stick with it, and they'll miss appointments. And I said, it's just not a priority to them.
Yep.
And I was like, you have to instill into them that philosophy that this has to be a priority to them. And if they make it a priority, they will show up and they'll value it.
Yeah. And this is why we in our office make it a priority to see patients between training. And we hire people who want to train and they want to learn and they want to make a difference, because I can't be the only one speaking the language. My patients have to hear it from me. And then when they go to my front desk staff and, try to maybe skirt around the issue, my team is going to hold the same solid ground that I do. They know how to communicate to people. We need to teach that too.
Yeah. And I guess that's a part too, is communication. Going into this second question that we have is like chiropractic students. We're talking about us understanding it and why we do it. But what advice do you give to students? Because I know you do a lot of work with the students.
I do. Well, my first advice to the students, like I've already said, is it's got to go to the doctors. The doctors have to step up and start teaching the students. We have, almost 100 students that have come through my office that in order for them to come and do the PEAK program, they have to interview with us. And if they're willing and they're willing to do the hard work, because we work hard and we play hard, but they have to be willing to put the time in. We have a blast. My docs still keep in touch with us. We train and still coach a lot of them. But we have to step up as a profession and teach our students. But they have to learn some of the things that they're not learning in school is business acumen, communication, get really good at your philosophy. And as we're learning that, we're doing well with that, we're getting solid with that, we have to bring that to the community. One of the things I think, so with your degrees, right, you have experience with going out into the public or, bringing the podcast out. I mean, you had to learn these things as you went, but you know how to market. Chiropractors don't know how to do that. And digital marketing is a bear. Oh man, it's painful. There's always algorithms are changing and what people want changes and people's attention span changes. So yeah, we still have to do some of that. But what I've found is when you make lasting relationships in your community, that, nobody can ever take that away from you. So we would go door to door to businesses and introduce ourselves to people. We would go, we'd go to every city hall meeting. And one day, if I can elaborate, one day we found out that our city had the highest gas prices in the entire country, our little city of Sugar Hill, Georgia. And so what happened was our city manager never hedged the gas prices. And so that means he didn't buy it ahead of time. So we were left hanging. Whatever the gas prices went to, we were paying it. So we had people, instead of paying $90 a month, they were paying $400 a month. So all these groups and organizations were coming around trying to get the city to lose its charter and be a part of the county. And what we found out is once you lose your charter, there's no getting it back. And so you no longer have your individualization. So Joe and I were adamant about fighting hard to make sure that the city that we've planted our roots in is going to be a city that we can grow in and be leaders in. So instead of complaining about the problem, we decided to create a solution. And we went door to door to 1,200 homes, knocking on doors, getting people to sign their autographs so we could save the city charter. And then we went to the city hall and we started talking to the mayor and talking with everyone there. And we made a proposal to start a Sugar Hill Fall Festival. Now, we had already done Kids Day America for a couple of years. So that was great prep work because both of those we had like 12 to 1,500, three of them we did, 12 to 1,500 people each one. So we decided to convince the city to start the Sugar Hill Fall Festival. And this weekend, they're going to have the 15th or 16th Fall Festival. Yeah, it's pretty crazy. But you never know how far reaching, right? You got to step outside your comfort zone and do the hard things to make the difference and let people know who you are. So now we're leaders in the community.
And that's just the playbook for any chiropractor, students or people that are in practice. Is if you want to be an impact in your local community, you can't hide inside the four walls of your practice. And you have to get out there and touch your people. And that's why a lot of the docs that don't have that skill set, they want to hire me because they know that I'll go out there and I'll engage their community and I'll tell them how they can be helped with chiropractic. But I do think that it's an invaluable skill set that people learn how to sell chiropractic to the public. And I think it's invaluable to also, like you said, get involved with your local community. Now you have a festival that you helped kick off 15 years ago. And I'm sure that because you're doing that, that helps grow the practice.
Yeah, for sure. Absolutely. Because when people recognize our name and they think that we're a trusted source because the city trusts us, then they show up. No questions.
And I'm sure because of the impact you had going out and helping with the political movement with the mayor, they were like, well, who are these people? Why are they so on fire? Like, why are they doing this? And I'm sure they had a different level of respect for the chiropractic profession, knowing that you guys were willing to give your time to that cause to make the community better. And I think that everybody can learn from this. Is sometimes you just have to roll your sleeves up and you got to go out there and do the work. And people aren't just going to come to you. Like you said, marketing is a tough game. And
hard.
and business and positioning yourself as a leader in your community, it takes some time to do that. But you have to continuously show up and you have to do it the right way. And, referrals are great, but it's also nice when people know who you are and they say, hey, you just got to go see that clinic because they're good people in our community.
Yeah, true that. And, as a student, going back to that question, it doesn't start when you get out into practice. If you wait till you get out, it's a bumpy road. It's a bumpy road. I don't know, somewhere along the line, somebody said 5 years in, it gets really easy. It actually never got easier because when you're trying to get a message across and you're trying to teach people and you're trying to make a difference to people's lives and, not just kind of be whatever other people want you to be, it's work and it never stops. It never stops.
And that's why I have such a love for the profession, because the group of people that I support all work hard, all became doctors, and they're all out there serving their communities. And I think that that's something unique about chiropractic is you guys don't have that residency where you just go and get plugged into a hospital system that the people just show up because that's what they do.
Right.
Like, chiropractors have to go out there and grow their practices, and they have to sell chiropractic, and they have to be able to support themselves through whatever methods that they think are the right things to be able to put food on their table. And marketing is probably the one thing that I've learned over the years that most everybody needs and nobody ever teaches them.
No, we were so clueless. I mean, we had one guy we hired clueless about, this was like, I'm going to age myself here, but when the internet really first came along, I mean, it wasn't that far in, we hired this guy and I get this bill on my credit card or a charge on my credit card for $20,000. I was like, and we were like, that's it. We need to learn about this. So we started going to like all the big conferences, like not chiropractic conferences, but marketing and figuring out how do other professions do it? How do the people who market do it? Not the professions who use the guy who markets, but the marketer. Like, I want to know what you do. And then I'm going to take your strategies. And then I'm going to know, at least, even if I don't have the time or the energy or the bandwidth to do it, I'm going to know how to ask the right questions to hire the right person.
Amen. And that's what I've done over my time. I've gone to the Grant Cardone events. I've gone to the ClickFunnels events. I've gone to all the inner circle stuff. I've done all the high level, like networking within the smartest marketers in the world space.
Yeah.
And when you do that, now you create your Avenger team and you find all the people out there that you appreciate and what they do, and you become friends with them.
Yep.
And that's probably the most brilliant thing I would tell anybody that wants to learn the marketing game. Go show up, shake a lot of hands, make great connections and learn from them, but also be their friends. Like, the reason that they work so well for you is because they want to see you win.
Yeah.
And I think that that's the right thing too, is marketers need good relationships, and chiropractors need to know good marketing. So it just makes sense that you learned that what you did makes a lot of sense, is you got out of the chiropractic seminars and you started going to learn from the people out there doing the work. And
Yep.
that's how you start to understand how to better hire somebody or how to network with that community.
For sure.
Rubbing the crystal ball here. 20 years from now, where's this profession headed?
So I was actually with Guy Riekman a few weeks ago, and he said, watch out. There are computers, AI, whatever, that's being created right now to be able to calculate your measurements of your subluxation and adjust for you. So watch out. The profession is in trouble. And while I can see it coming, I mean, everybody's not going to buy into that. This is not going to be an across the board thing. I believe that one of the many reasons why people go see chiropractors is the hands-on experience, right? They get to communicate with somebody who actually listens to them. They get guidance on how to live a good life. We become a part of their families. We're the family doctor that doesn't exist anymore.
You've made it to Chiro Hustle. Sit back and learn from the greatest influencers in the profession on the world's #1 chiropractic podcast. This episode is brought to you by Peach State Payments. Ethical processing, more profit, less stress. Chiro HD, more than an EHR. Practice management simplified. The Chiro Speaking Company. Attract, educate, and convert. Chiro Spring, cloud-based, user-friendly software with all the essential features chiropractors need. OmniWave, redefining comfort and acoustic wave technology. The ChiroHustle Podcast is sponsored by Chiro Health USA, ChiroScript AI, Chiro Moguls, Pure Chiro Notes, 5-Star Forge, Titronics, Sherman College of Chiropractic, Life Chiropractic College West, and the IFCO. Let's hustle.
We are the ones that people come to for everything. I mean, somebody just asked 2 days ago, my associate doctor was like, I didn't know what to say, which was really odd to me, but she said, I didn't know what to say. The patient said, well, I want you to be my family's family doctor. And she was like, okay. I was like, that's amazing. We love that. That's what we are. We already are there. Most people's family doctor.
Well, that's why I open up the conversation in the podcast saying medical freedom and family health freedom. Like, if you don't know what that is, go connect to the chiropractor, because that's the exact topic that I'm talking about. Is people definitely need that point of entry from somebody that they can know, like, and trust. Mm-hmm. And I think that says volumes about having a practice in chiropractic, because back about 5 years ago, they were having this real debate about, should chiropractors be point of entry? And should people come into chiropractor for their primary? Mm-hmm. And should that create the pipeline then for chiropractors to refer out to other disciplines? And I just came to terms with it, and I'm sure you've heard this said before, but there's no money in healthy people. So if chiropractic was like the first port of entry for all patients, then
medicine is in trouble.
Yeah, because people would just start getting better.
Yeah.
And that's the truth about chiropractic, is it doesn't involve pills, potions, or lotions. I'm sure you heard that 1,000 times at DE. Yeah. And I learned this from Les Brown. He said, you don't got to cut it out, drug it out, or burn it out. And that's why he loves chiropractic. But when you think about like why these people are coming to you and asking for your associate to be their primary, it's the same reason.
Yeah.
We don't cut it out, drug it out, or burn it out. And they trust you as their provider. And I believe that that's the course of action that's happening right now. I see it all over the place. People are losing faith in the big box medicine system. Mm-hmm. And they're saying, what else is out there?
Yeah. I was actually, it's exactly it. I was talking with Del Bigtree like a week ago, and he said the same thing that I've been saying for the past year or two. People know enough to know that they don't want what they've been getting. They just don't know where to go. So that's why, just like you are bringing chiropractic out to the masses, I've started some organizations. Like early on, I started Kilt's Healthcare Alliance. And the reason why I did that is because as I was realizing how much they don't know about real healthcare, about what we do, about how we might be able to work together because they have influence over people's lives. I started this organization, or I started reaching out, and they wanted nothing to do with a chiropractor. So I was like, okay, I'll make an umbrella company, Kids Healthcare Alliance. And this is an alliance where all pediatric healthcare professionals can come together. We can network, we can refer. I've had the opportunity to teach them how not only to refer to me, but how to send my patients back. They don't know what they don't know. And now they call me for advice. They call me when they have a patient. They, should I send them to you? Is this what we should do? Or I was thinking this, or, what do you even think about supplements? So I'll lead them and guide them down that path as well. And now that I'm moving into my kind of semi-retirement years, I'm passing that organization on to my associate doctor who's buying my practice. And I have just been voluntold that I'm taking over a women's empowerment group. And these are all women that are in the personal injury space all around Atlanta. So they're chiropractors, they're orthopedists, they're PTs, they are neurologists, they have lending companies, they have MRI imaging centers. And, it's not that I'm a PI office. We are far from that. I do take care of personal injury cases. Maybe 10% of my practice is PI. But these are people that don't know what we know. So any space that I can get out and I can lovingly bring people into my world, share my story, elevate them, lift them up with the things, with the wisdom that I've gained over the years, people will automatically start flocking to the spaces that we run.
Well, it's the evolution of truth, and there's not a lot of truth out there. So when you can be the guiding light for people and that lighthouse for people to know that you're set with your belief systems, that's attractive these days.
Yeah, very much.
And with leadership and guidance, all those people are looking for people to fill that gap and stand in the gap with them. Because honestly, like Del said, most people just don't know where to go or who to trust.
Yep.
So if you're so firm and set with your beliefs, then you can have the power of influence. And what you've done is Napoleon Hill's work in creating the mastermind and, creating those people to come together. Now they're all sharing the message together and finding new ways to support the communities. And really, that's the biggest grassroots effort you can ever hope for, is to bring people together to start understanding chiropractic. And one of my buddies, Sachin Patel, he quoted me on his podcast like 8 years ago. And it was, if people know what we know, they do what we do.
For sure.
And it sounds like you're starting to seed that into, even now, you're seeding that into your associate. And now you're elevating into another group. And it's really cool to hear how you've taken the knocking on doors to save the gas prices and saving your community to now going at a larger scale and teaching the chiropractic students about philosophy and business. Not only that, but now including the chiropractic message into the orthopedic profession, into the personal injury world. And now people are starting to understand that chiropractic is a force to be reckoned with.
It really is. It really is. They just need to know.
Yeah, and that's the thing. And I know that I wanted to touch on a couple more topics with you as we come to the end of the interview today. And one of those things is evolution and practice. I know we spent most of our first 20 minutes before we went live just talking about it's okay to evolve with your practice model. It's okay to practice how you see fit for your community. And there's a lot of people out there that are suffering once again and dealing with things that are mysteries. And you've transitioned more into a functional medicine style practice. Tell us a little bit about that, how that evolution happened, and a little bit how you've had to transform energetically to understand that role is okay.
Yeah. So as I told you before, I called the start of that evolution, the dark years, because it was really hard to go from a straight chiropractic DE type practice to my husband getting sick with Hashimoto's, 3 years of nobody diagnosing him. And, they would say he had postnasal drip and reflux and all kinds of garbage. And they would give him scripts that we never took, but we knew that wasn't the issue. And finally, a functional medicine doc said, I'm seeing what the issue is. Let's do these tests. We find out he's got Hashis. The root cause is coming from his gut. It's coming from his adrenals. It's coming from his thyroid. He's got an underlying virus that nobody's ever looked at. And so when we fixed the root cause, now we got into functional medicine to learn how to fix him. But as we started walking into our office and put on what my husband calls the Magoo glasses, he starts looking at people, we both did, in a different way, like, oh my gosh, that's why she never holds her adjustments. That's why she's still on those meds. We started saying, go tell your doctor to test these labs. Go ask them to check these values. And not once in 2 years did anybody come back with a full set of labs. So we came back. I said to my husband, you got sick for a reason and you need to help people because nobody's helping these people. And if they can't hold their adjustments and I'm just adjusting, really, what benefit is that? They'll hold their adjustment for an hour or day, and then the rest of the week they're spent messed up again. So we decided, we went through all the legals to have medical staff underneath us, and we went 5 years with a medical team with 17 people underneath me. It was hell on wheels. We were billing insurance. That's why I brought the medical team in, because I was like, well, if people could use their insurance, then they can get all the tests. But then I found out that they don't cover the tests. So I literally fired everybody. I fired every insurance company. I fired all the medical professionals and most of my team, and just have my skeleton crew of philosophically sound people. And my husband's been doing functional medicine on his own. And we have a team, myself and other docs that are doing the chiropractic adjusting. He still adjusts, but we are in that space where we're able to give, love, and serve out of our abundance. And in our knowledge, we know deep in the deepest depths of our souls that if we don't remove the toxicities, the interference that's keeping people from expressing their full life experience, we'll never get to the other side. And it wasn't until a few years in when I started to see the difference that it was making for people that I started to come to the conclusion that, it is okay. Not only is it okay, it's necessary for me to practice within my values. My values have to come first before anything. And I believe firmly also that if BJ Palmer were here today, he would be doing more than just adjusting a bone. He would be working on root causes and finding out, what's the best things that we could use for these people to get them healthy.
Well, I also believe that BJ would have chiropractors in every hospital around the world.
Oh, for sure. For sure.
And it's not that, I just gave that talk I was telling you about out in Virginia. And I said chiropractic is a standalone profession. It's not the medical profession. Mm-hmm. It is chiropractic.
Yep.
And I go, chiropractors have a science, philosophy, and art that sets them distinct from everybody else out there. And the medical profession wanted to absorb chiropractic to make it weaker.
Yeah.
And to take their philosophy and to be able to regulate how chiropractors earn their money. And it's just really odd to me, or maybe it gives me some more clarity, that you thought that was the right way and you brought in the whole team and it was madness. And then you realized you didn't need any of it.
Nope.
And you could come at it from the scope of a chiropractic philosophy and it worked better.
Yeah.
And that's the thing that's happening is we are so in trouble financially with the healthcare world that doesn't involve chiropractic. And, I was telling you the numbers. There's like 103,468 chiropractors globally. And to think,
enough.
Well, here's another thing I impressed upon that group too, as I said, the running number and like the really shameful topic that a lot of chiropractors speak from the stage, we're only seeing 6 to 10% of the population. Well, if you're only 70,000 people in a world full of 8 billion, that's pretty impressive. To see those numbers on such a small level of people out there doing the work, that's pretty significant.
Actually, that's true. But I don't know if you're aware, there's all colleges are very afraid. They're looking to the future and realizing that a lot of those kids that would have gone to college are not going to go to college. And the chiropractic schools are talking about that too now. So we gotta watch out for that.
Well, To be honest, the chiropractic colleges need to put chiropractic back into chiropractic.
Yes, they do.
So we got to watch out for that too. And I think that that's the significant thing too, is if we want to see this profession thrive and flourish long term, we need to create chiropractic and the chiropractic relationship with an education.
Yeah, that's very true. I mean, we're not going to see the miracles like we've gotten to witness over all of these years if we don't give real chiropractic care to people.
Yeah, we're working on borrowed time.
Yeah, for sure.
And I know the future is bright for chiropractic because there's nobody else out there that can check, detect, and correct a vertebral subluxation.
Just us.
And nobody else wants to own the word subluxation anyways. So some chiropractors don't even want to own the word subluxation. So
unfortunately, you're right.
We have to stick to our roots and do our best for our communities. And I think that this episode is dynamic. I think we got a chance to talk about how you got into the profession, where you are today, and some of the ideas about how to grow a practice and have responsibility in your communities. Is there anything I didn't ask you that you wanted to touch on today?
Just look out for me as I'm starting to get out there. I'm working on building a podcast, writing a book, Death My Menopause. I spent what I call 7 years in the desert, even being as healthy as I am, being adjusted from the day I was born, not vaccinated. I suffered significantly through menopause, and I worked with functional medicine docs, and I worked with functional neurologists and acupuncturists and autoimmune diets and all kinds of supplementation and things like that. And unfortunately, I have genes just like my mom, and I haven't been able to flip that. Every time my mom and I do something, we get the opposite results. But I've seen us working with all of these women over the last 18 years that we've been in functional medicine. I see women get better. And if they're healthy before they go into menopause, they're going to have a better menopause. And menopause doesn't have to be the death of you. If you're in it or you're going to be in it, there's a way to transition through it. Chiropractic is a part of it. Knowing your body chemistry is a part of it. Healthy living is a part of it. But if you don't have good guidance and support, there's just a ton of confusion out there. And I want to lead women to live a better life. And you know what I keep hearing from men? Like, I want that book. I think I might have to come out with a men's book, like how to handle your wife going through menopause.
Well, I think that we all need resources.
Yeah.
And it sounds like that's an evolution in your career now also.
For sure.
Is practice, starting it up, building yourself into a pillar for your community, and then realizing that it's okay to transition your practice model. And now it's okay to transition into the influence marketing arena and be the published author and create solutions and a playbook for people to find solutions for themselves.
I remember years ago, my husband said, we've been together since high school, like I said, and I don't know, we were in chiropractic school and we get into a fight and he's like, you've changed. You're not the same girl I met when we got together. And I was like, at first I took insult to it. And then I was like, oh, it's like, thank God. It's like, thank God. Do you really want to be with the 17-year-old girl you were with? And the same thing is for every part of your life. Do you want to be the investor you were when you were in high school? Do you want to be the husband or the wife that you were when you got married? Do you want to be the professional that you were when you started your practice? We should evolve. I think it's necessary for us to evolve. If we don't evolve, then our kids see the child in us. They don't see the adult in us. They don't see the possibilities of where your mess ups have gotten you. And one of the things I am never too bold to stand up and talk about are all the screw ups I've done. Because if I can help you from screwing up, then it gets you that much further. And even with our interns, we're like, listen, you can scrape your knees, but we don't want you to fall into potholes. If we can help you to avoid those, you get a little bit of pain, you get some scar tissue, it helps you to get through it. You learn from us. But, I don't want you to go bankrupt, or I don't want you to ruin your practice, or I don't want you to ruin your family. Right? Like women in chiropractic, I see all too many of them stressing out over, do I practice? Do I not practice? Do I have kids? Now's not the right time. I'm too stressed. I don't know what to do. Make a plan, follow it, and follow people who've done it before you.
Yeah, mentorship is huge.
Mm-hmm.
And today's your birthday, so happy birthday.
Thank you very much.
And I feel my birthday is October 1.
Happy birthday.
Yeah, and I just did the 47 thing. And I tell people when they engage with me is I go like, look, we should get more wisdom, and we should share that wisdom.
Yes, we should.
And that's the opportunity that we have with age, is to take the knowledge that we have and to share with other people.
Absolutely.
And that's our legacy that we'll carry on with. And Deb, I really appreciate you being on with me today. Episode 749 of the ChiroHustle Podcast. I know people are going to say, how do I reach out to Deb? And I think you sent me some handles here. Is this your Instagram, Dr. Debbie?
Yeah.
Instagram. So that's DocTaDebbie for Instagram. And if you want to connect with her through email, it is chirodoc44@gmail.com. And you can find her on Facebook or Facebook Messenger at Deb Cirone.
Yep.
Really cool to have you on today for this episode. And thank you for your lasting impression with the chiropractic profession. And I can't wait to see you sometime in person. And I'll just go ahead and close out, and I'll tell everybody like I always do. You guys are just one story away. Keep hustling. I'll see you guys on the next episode. Bye for now.
Thanks for listening to Chiro Hustle. Don't forget to subscribe and check back next week to continue hustling.